Namaste everyone. A very warm welcome from uh, Jayadeva Memorial Rashtrotana Hospital and Research Center. And I'm Dr. Savinay, a senior consultant pediatrician and neonatologist working in this hospital. Today, I'm going to be talking about our hospital services, our consultants' experience, and also I'll be talking about two important topics which are relevant for the children and parents. One is about recurrent infections in children and how there are ways and means to build up the immunity in children naturally. And the other important topic will be how to avoid fights over food in children, which are very relevant for parents in this age group, in this age. So first, I'll be talking about our hospital services. We are a team of 3 specialized consultants who are dedicated to the service of pediatrics and neonatology. And very well supported by the experienced and qualified nursing staff. We have a 24-hour emergency services, ICU services, OPD and inpatient services at our hospital. Coming to the NICU, ours is a level 3 tertiary care level NICU capable of managing preterm neonates from 26 weeks onwards, and also we are very well capable of managing a sick newborn, be it surgical cases, a term neonate or anyone. We have a ventilatory services and also a very well equipped tertiary level 3 NICU. We also have a 4-bedded PICU capable of managing pediatric ICU cases, pediatric emergencies, and also we have a ventilator at our disposal in our PICU unit. We have round-the-clock consultant cover 24 hours a day, and also we have a very well-equipped emergency services 24 hours a day, and with well-qualified and experienced nursing staff at our disposal. Let me now talk to you about our team of experts which we have. Our team of experts include, I am Dr. Savinay, a senior consultant pediatrician and neonatologist who will be heading the department, and I have more than 20 years of experience in the field and 6 years in neonatology. I have completed my DCH and DNB from India and MRCPCH from UK. I have worked in tertiary care level 3 neonatal units in UK and pediatric hospitals in UK. I have a very qualified and experienced colleagues who are with my services. My colleague is Dr. Nivedita. She is a senior consultant pediatrician and neonatologist. She has completed her MD and also she has done a neonatal fellowship from Rainbow Hospital. Actually, we both are neonatologists. I have completed my neonatal fellowship in Cloud9, and Dr. Nivedita, she has completed a fellowship from Rainbow Hospital. So we both are qualified and experienced pediatrician and neonatologist capable of managing pediatric emergencies and neonatal ICU services. We also have Dr. Vishwanath, who is a consultant pediatrician and a pediatric intensivist. He has completed his MD and pediatric ICU fellowship from the Indira Gandhi Institute of Child Health. He is a qualified pediatrician capable of managing NICU and PICU cases. Above all, I would like to take this opportunity to thank Dr. Swarnareka Bhatt, who is a senior consultant neonatologist, and we are all working under her supervision and guidance. She was the former HOD of Department of Pediatrics and Neonatology at St. John's Hospital for more than 3 decades, and we are very blessed that we are working under her guidance. Today, after going through the department services, I am going to be talking about a very common topic which brings the parents and children to our hospital. One of the primary concerns is my child is getting frequent infections and how to improve his immunity. When we talk about this common condition, the parents come and tell them, do we need to do repeated investigations and do we need to give repeated antibiotics for the child? The answer is no. Most of the time, it's the immunity which is the problem in the child, and there are natural ways to build up immunity for the child in this condition. The first question that comes is when the children comes to me with this problem, I ask the parents, are the parents healthy? Do they do regular exercises? Do they take a regular good diet? Do they follow a good exercise regimen? The answer is no. When the parents don't follow a healthy lifestyle, no matter how many times you tell the children to follow a healthy lifestyle, maybe 100 times, 200 times, it will be of no use. If the parents are not healthy and if they are not following a healthy lifestyle, no matter how much advice you give to the children, it will be of a waste and they will not follow you. So if you want a child to be healthy, the parents should be healthy. If you want a child not to be obese, the parents shouldn't be obese. If the parents are obese, it's 100% sure that the child will also become an obese child and a lazy child. So if you want the children to follow you, the parents should set an example. The first thing, if you want a healthy lifestyle, be a good parent. So next I will come to the 3 pillars of good health. What are the 3 pillars of good health? One is diet. Are you following a good diet? The diet should include lots of fruits and vegetables. If you want to give a good diet, give colorful fruits and vegetables like carrots, green beans, which will build up the immunity naturally. Next important thing is exercise. You tell the child, go and do exercise. Do you think he will do it? No, he will not do it. You should set an example. You go and play with the child. Set 1 hour a day for the child, for yourself and the child. Do some fun exercise promoting activities like swimming, like cycling. Go with the child for a cycling. He will follow you. But if you just tell him to do exercise, he will definitely not follow you. And same with the diet. If you eat junk food and you advise the child to eat fruits and vegetables, it will be a waste. You set an example. You eat lots of fruits and vegetables, he will eat. Next important thing is sleep. Are we giving a child a good sleep regimen? He should sleep around 8 to 10 hours a day. If you go to a daycare, suppose the child goes to a daycare, he should take adequate rest in the daycare. If that is not possible, make him go have a nap early in the night. So 8 to 10 hours a day of sleep is very essential for the child. If he doesn't get sleep, it will naturally build up infections. These are all risk factors for recurrent infections. No good diet, no good exercise, no good sleep. This child is prone for recurrent infections. Other important thing which we forget in all our children is connect. What is that connect? Connect is the mental health and the social health of a child. Do you think the child is not under stress? The child is also under very important stress. Suppose he goes to the school. He feels lonely. He is being bullied. He is under immense stress. You have to address mental health issues in a child. Very important. And also social issues. I'll talk about social health in this thing. Social connection. So in the COVID situation, we were socially isolated. We are not taking the child outside for the park. We are not playing within the garden. We are not taking the child to a relative's house, not mingling with friends. Do you think it will not have adverse effect on the child? Very much. So social connections, especially with the relatives, friends, and moving about in the park and going outside is very important. So very important which we neglect is mental and social health, which is very important for a child, which needs to be addressed. Other important thing that a child needs to have a good health is hand washing. Suppose the child goes out and plays and comes, do a hand washing. Suppose he goes to the toilet, do a hand washing. How to make a hand washing very attractive for a child? Give him a colored towel. Give him a soap of different sizes. use a hand sanitizer. You should like hand washing and you should like playing with that soap and the towel. Then he will do hand washing on its own. And very important, use mask for a child. Mask is, suppose the viruses spreads through the air, and if you use a mask, that can prevent infection. Give warm water to the child. Very important to give warm water. All these things will go a long way. But all these things are effective if the parent follows it. If the parent doesn't follow these healthy measures, no use telling the child 100 times, he will not follow you. So, what is the diet plan according to the age? So, less than 6 months, what you should do? The child needs exclusive breastfeeding. So, exclusive breastfeeding in a child will promote good health. If you give bottle feeding for a child less than 6 months, it will not promote good health. So, exclusive breastfeeding is below 6 months is very important. So, what do you do after 6 months? 6 months to 1 year, very important that we give a weaning diet. So, what is that weaning diet and what are the misconceptions of a weaning diet? So, what happens in a 6 months to 1 year? Parents give Cerelac. So, that's it. Build up the immunity. 100% no. So, what you have to give? Homemade diet like mashed potatoes, mashed carrots. All these things will build up the immunity naturally. So, you should make sure that a weaning diet, the food that you give is not like water. If you tilt it like this through the spoon, it should not come out like water. It should stick to the edge of a spoon and come out like a sticking to the edge. So homemade diet, which is like a sticking consistency, will promote good health. Don't give Cerelac, don't give all these artificial foods. Next, coming to the age group of more than 1 year. More than 1 year. What is most important? Give homemade fruits. Homemade foods like fruits and vegetables are very, very important. So, what is important? Immunize the child according to the age. Don't forget immunization, fruits and vegetables. And the parents are very much concerned. Sir, doctor, we want some supplements. What supplements will you give? Vitamin D? Yes, you can give vitamin D. And very important, at this age group, parents are giving lot of milk to the children. So when you give lot of milk, there is a deficiency of iron. There is anemia is happening in the child. So you should give iron supplements for these children. Sometimes, if you want to give multivitamins, don't give it on your own. Take the child to the pediatrician. He might supplement you with some multivitamins. So 6 months to 1 year or more than 1 to 2 years, very important homemade food, fruits and vegetables and iron supplements. Now the child is more than 2 years. This is the children who are very problematic. The parents are very much concerned. The child is eating lot of junk food, doctor, what we should do? So, the junk food is very addictive. If you get a cup of French fries, he will not leave it. He will keep on eating it. He will keep seeing the TV and he will eat the junk food. So, how to avoid it? So, my advice is, don't stop junk food altogether. Just give one junk food once a week. He can have junk food once a week. What about the other days of the week, doctor? So other days of the week you may give homemade food. But he doesn't like the homemade food, doctor. So you can make junk food like at home. Like you can make a wheat pizza at home. So that is like a junk food but you are making it at home. So that will promote growth and also it is very delicious. So once a day outside junk food and rest of the day junk food which you prepare at home will be very useful. So very important is advise the child about hand washing, which I told before. Exercises, regular exercises with your child 1 hour a day will promote good health. Let him sleep 10 to 12 hours a day. And these children have some infections like they have fever, sore throat. You take the child to a doctor. Don't give antibiotic unnecessarily. If you give antibiotic unnecessarily, there is a chance that these antibiotics will not be effective. Most of the infections that these children have are due to viruses. Viruses are not killed by antibiotics. If you give antibiotics, it's of no use. But if you give antibiotics, there is something called a good bacteria. There is something called good bacteria in the stomach. What will happen? These antibiotics will kill those bacteria and he will get infections again and again. So if you give antibiotic, next month he will come again and say, my doctor, my child is again having fever. You give antibiotic again, next month again so every month he keeps on coming with fever. So don't give unnecessary antibiotics. And other important child, sometimes the parents come, I want my child to grow taller, doctor, what should I do? So most advice is, which is naturally promotes growth, is sleep well. In the sleep, there is something called a growth hormone, which is being secreted in increasing amounts. So if the child takes good rest in the sleep, the growth hormone are secreted in increasing amounts, and this promotes growth. So two things are happening in sleep. One is getting adequate rest. One, there is less risk of infection because he is getting enough rest. And most important, he sometimes grows tall during sleep. So always make sure that he sleeps 8 to 10 hours a day, which promotes a good, healthy lifestyle. And and very important, keep up to date with the vaccinations. Very important, keep the child up to date with the vaccinations. Now I will talk to you about mental health and social health, which are very much neglected by the parents. So suppose the child is very lazy, lethargic, is always depressed. What do you have to do? How do you promote mental health? Just don't do anything. Just when the child comes from the school, just listen to him. No matter how trivial he is, suppose he has a concern, listen to him, address those issues, and in this way you are tackling his mental health. Suppose you are not able to solve those issues, talk to the pediatrician, talk to the mental health professional. They will be able to help you and solve these issues very nicely. Like I'll give you one example. There is one board which says, no farmers, no food. So what will you think? You think it's a normal situation, but the child thinks, no, if there is no farmers, I will not get food. What should I do? He is worried. So some things, so you have to sit down with the child. You have to address his mental issues and sort this out. That way you are sorting the mental health of a child. And social health, very important. Connect. What is that connect? Nowadays, we don't take the child outside to a park. Take a child outside to a park. Let him plant trees. Let him do some watering. So all these things make him connect with the nature. And also let him play outside. Let him play with his friends. Let him make friends. All these things will promote social health. And also, we neglect children taking to the relative's house. Take them to a relative's house, your cousin, your grandparents. That promotes good social well-being in a child. All these things. So, what I would say is, health means just not absence of a disease. It's a mental, social, and physical, and emotional well-being of a child. That is the definition of a WHO. So, very important that we address all these issues in a child when they are brought to the clinic. So if you have any concerns, you can let us know. So next important thing I would like to address is the child. I come to the doctor, the child, we are always fighting while giving the food to the child. What should I do? Suppose we keep a plate of bowl, he just fights and he refuses to take food. So how do you address these issues? I will be telling you about this very important 4 tips after how to avoid fighting over food in a child in the next video. Yeah, thank you.